Flying, speed, tripping, strung out. You meet him somewhere in the middle of his journey. You don't know where he's coming from or where he's going. You've reached him at a turning point that can lead him back or lose him. And the only signpost you can see says overdose. Amphetamines, alcohol, aspirins, hash, glue, horse, mescaline, phencyclidine, THC, uppers, downers, hallucinogens, medicines, booze, hard drugs. There are a lot of different ways to start the OD trip, but they lead to a common destination. Almost all overdose deaths come from hypoxia, lack of oxygen caused by depressed breathing. Every overdose victim, no matter what he's taken, may need your help to keep breathing. That's the fundamental fact of OD emergency treatment. You begin, of course, with ABC, airway, breathing, circulation. But more than a pulse, you'll need to check blood pressure. Get an exact systolic value you can use as a baseline to monitor any changes. For the overdose victim is on a trip. He may not stay where you find him when you first come on the scene. He may be stable for a while, then plunge into a respiratory depression spiral that, unchecked, leads to death. Check his level of consciousness. If he's drowsy, he'll react to voice.
Hey, wake up.
Leave me alone.
Or give a vocal reaction to pain.
Don't. God.
You can tell if he's pretending unconsciousness by a quick lift of the eyelids. The comatose victim looks straight ahead. The pretender tries to hide. Another good check is the arm drop. The pretender is careful to protect himself. The real one isn't. If the victim is truly unconscious, you take the most important step in overdose treatment: the bag mask. Oxygen alone is not enough. Overdose of any kind affects the brain, depresses breathing, causes a hypoxia spiral. Lack of oxygen leads to lower breathing, which in turn reduces oxygen intake even further. This is the only way to make sure that oxygen gets into his system. You have to assist. It's important to measure the level of consciousness right away so you can determine his condition and spot any later change. The lightly comatose victim has a defensive reaction to pain stimulus. If he's more comatose, his reaction may be non-defensive, movement unrelated to the location of the pain. And if he's in deep coma, he's very close to death, and there may be no physical reaction at all. Whatever his level of consciousness, be alert for changes. If he goes any deeper, call the hospital at once. As soon as you've taken care of the victim's immediate needs, make a quick assessment of the situation. Is it OD, or illness, or trauma, or a combination? If there are witnesses, ask questions.
What happened?
He passed out.
How long ago?
20 minutes ago.
Yeah.
You know if he hit his head on anything when he fell down?
He fell flat backwards. He
He might
didn't
have
hit
hit
any
his head
furniture.
pretty hard when he landed, but
Has he been drinking it all today?
We split a pitcher of beer during lunch.
Just the one?
Just one. Is he going to be okay?
I think so. Does he have any medical problems? Does he take any pills or anything today?
yeah, he does. I saw him take a couple right after he got back from lunch.
You know what he takes?
Oh, I really don't.
No, they're on the dresser.
Oh, I'll see if I can find it.
Please.
Frequently, you'll find there's more than one
What his
substance.
problem is?
Alcohol and tranquilizers, diet pills and narcotics, every imaginable mixture. If there's time, look around for bottles, pills, anything the victim might have ingested. But don't lose time playing Sherlock Holmes at the risk of the victim's life. Where his trip started doesn't matter as much as where he's headed right now, because you're traveling with him. On the way in, check his vital signs again and again. Monitor for any downward trend. Here's where that systolic blood pressure can alert you to sudden changes in his status. Any overdose victim, OD'd on any substance, can seem okay 1 minute and take a plunge toward hypoxia the next. If you miss the signs, you may miss the point where he turns off permanently. These are the 5 key steps to bringing your overdose victim in alive. Check the airway, breathing, and circulation. Determine his level of consciousness. Assist breathing with a bag mask if he's unconscious. Assess the situation for possible trauma, illness, and how much of what was taken when. Most important, monitor his vital signs. Is he going up or down? His life may depend on your knowing the answer. Let's look at the outlines of a few OD calls, situations that actually happened. Watch how the EMTs handled each call and ask yourself, what would you do? We'll start with the case of the happy kid.
Gonna be okay? Want me to call your folks?
If you throw up, maybe you'll feel better.
Huh?
Sometimes it helps.
What do we have here?
Looks like he's kind of wiped out.
How you doing? Did you drink all this? Did you drink this?
I think so.
I think so. I think he
Anybody
did it
with him?
alone. Uh-oh, we didn't see anybody when we came on him.
You get his name, by any chance?
He wasn't very talkative.
I'm not saying much.
Think he'll be okay?
Oh, yeah, I think he's probably just drunk.
God, I don't envy him.
He's gonna have quite a head tomorrow.
Remember your first time?
Yeah.
Ugh.
Barely.
Yeah.
Yeah,
bad.
everybody has to learn the hard way.
Really?
Well, I don't think he'll forget about this for a while.
Blood pressure's good.
Yeah, the pulse is good, too.
How do you find his folks?
Oh, the hospital will take care of that. They'll notify that.
Then I think on the way back, I'll ride up in front with you. Just let Junior sleep it off in the back.
Okay.
Okay.
Good luck.
Junior didn't get a hangover. He was dead on arrival at the hospital. What would you have done to prevent it? The empty bottle was a good indication that he might have taken a lethal dose of alcohol. The victim's age was a good indicator that he could have a low tolerance for alcohol and no judgment in using it. An assessment of the situation would have pointed to acute overdose. A second check of his vital signs would have discovered his abrupt plunge into hypoxia, and a breathing assist from the bag mask would have saved his life. Then there's the case of Sherlock Holmes and the suicide attempt.
Laura? Laura? Has she said anything since you've been here, Bill?
John, I came as soon as you called and I found her like this.
Laura!
Do you want me to call her folks?
No, please, leave them out of this.
Okay.
Gentlemen?
Laura, man, we
What
glad to
happened?
see you.
She took a whole bunch of pills.
You know how long ago?
Well, I talked to her on the phone about 15 minutes ago. She called me, and she was really groggy then, so...
I got here about 10 minutes ago and she was laying just like that.
You know why she took them?
We had a fight last night. She got really upset. And I think that's why.
She gonna be okay?
Is she gonna be all right?
Her pulse is good and strong. Have you any idea what she took?
Just what's here.
About 110 over 60.
Her pupils are big and awful sluggish.
Yeah.
Got any sleeping pills there?
Oh, look, she takes tranquilizers. I think they're in the medicine cabinet.
I'll get up.
There's something here called allopurinol,
Okay.
ampicillin. There's some Darvon.
It's a Darvon.
Yeah.
What are these things?
This is kind of
Cigarettes.
there's a whole bunch of different ones in there and these.
Ever heard of anything PenVK?
Oh.
There's some Dilantin. That might do it.
This woman recovered, but they came close to losing her. What would you have done? It's what you wouldn't do that would help her. You wouldn't waste time playing Sherlock Holmes with a comatose victim needing a bag mask and a fast trip to the hospital. The wide variety of common drugs and all their combinations make on-the-spot diagnosis difficult. Dilated pupils can indicate alcohol or stimulants or hallucinogens, or they can mean your patient has died while you were guessing. In any overdose situation, the most important thing to assess is the victim's condition and needs. How about the case of the snoring derelict?
Hi, fellas. Greetings. What do we got here?
Another drunk.
Another drunk.
Yeah.
Okay. You know him?
Yeah,
Who he
yeah,
is?
his name's Lenny. He hangs around the neighborhood quite a bit.
Watch out for this.
Yeah, one of the local juicers.
Uh-huh.
Quality of his alcohol's improved, though. He goes from wine to brandy.
Top shelf.
Yeah. Yeah, I saw him about an hour ago. He was pretty loaded then. I came back here, and there he is, passed out.
This isn't the first time he's done it.
Oh, no. They come and get him a couple of times a month.
Uh-huh.
His pulse is about 90.
90? Okay.
You guys are new around here, right?
Yeah, we
Haven't
normally
seen
don't
you
come
before.
around this part of town.
You'd recognize him.
You want to give us a hand lifting him up here?
Yeah, why not?
About 145 over 80.
That sounds pretty good.
Doesn't look like a lightweight.
Cool here.
Ready?
Okay.
Go.
Oh.
What do you do with him now?
Oh, we'll take him down to detox, let him sleep it off.
Well, I appreciate you coming and getting him.
Better off.
Look at, he sleeps and you guys got to work.
This man might have slept longer than anyone anticipated, and not because of an overdose. What would you have done? When you assessed the situation, you'd have added up the broken bottle and the nearby steps to get a good possibility of a hard fall and resulting trauma. An assessment confirmed by a check on his level of consciousness. Deep coma, indicating a probable head injury. As for his peaceful snoring, it was a sure sign that his tongue was dropping back to occlude his airway. Let's look at a more common situation. Call it the case of Dr. Kildare and the good horse.
Honey, come on, wake up. Come on, there's somebody here to help you. Come on, sweetheart. I'm sorry. Come on, wake up.
What happened?
Oh, it's all my fault. I just wanted him to be special. He's been gone. We went out to eat and we had a lot to drink. Just passed out.
How long has he been drinking?
Oh, we've been drinking all night.
What is that?
How long ago
Sure.
did he pass out?
Oh, about 20 minutes ago, but he also did a little bit of heroin, too.
How much?
Oh, just a little. He just snorted a little, but it's never happened like this before.
He's done it before?
Yeah, but it never happened. The guy
Come on,
said it
wake
was
up here.
special, that it would make him feel good, but it didn't. Oh,
Come on, John, wake up.
come on, honey, wake up. Is there anything I should do? Should I make some coffee or something?
No, coffee wouldn't help him.
Is he gonna be all right?
Come on now, wake up here. Yeah, he'll be okay. Want to hold his head up,
Sure.
please?
Come on, honey. You'll be all right.
120 of about over 70.
His pulse is good, too.
Yeah.
Remove him.
Yeah, why don't we move him on the stretcher?
Okay.
Go.
Come on, John. Wake up here. Try to keep him awake while you're riding with him.
All right. Get a palpated pulse here. Got a systolic about 115.
Okay.
John. Hey, John.
You saw them go through all the right steps. Airway, breathing, circulation, level of consciousness, assisting breathing with the bag mask, assessing the situation, questioning the witnesses, identifying the drugs, even rechecking the vital signs to determine his trend. What else would you do at this point? You'd stop wasting time playing Dr. Kildare and get him to the hospital. As long as you keep a close watch on him en route, keeping him awake is less important than keeping him alive. More important than any list of steps or rules or do's and don'ts in overdose situations. Keep them breathing till you get them in. And the most effective diagnostic and treatment tool you can work with is your common sense.